All right, let's finish off Unit 3. We're going to talk about ions a little bit more. Ions are going to have three general functions, helping to maintain that osmotic pressure because they are going to be a driving factor for solute concentration. They're going to act as buffers, and they're going to help control, because their solute concentration and maintaining osmotic pressure are going to help control water absorption and secretion. All right, let's talk about ions here. Ion concentration can be typically divided into a couple of categories. These concentrations will typically be seen in certain compartments of the body. So for instance here, sodium, we tend to want a greater sodium concentration outside of the cell than inside of the cell. ECF is an abbreviation you really need to get comfortable with. ECF is referring to extracellular fluid. It's referring to what is outside of the cell. ICF here is intracellular fluid, also an abbreviation you need to get comfortable with. It's referring to what is inside the cell. So typically we want to see greater sodium concentrations outside than inside, greater potassium inside than outside. So here are some of our ions. You do also want to become comfortable with some of these more common element notations. For instance, this is sodium, potassium, calcium, magnesium, phosphorus, oxygen, chloride, carbon, hydrogen. This is just reiterating. Fluid has more sodium and less potassium. That will be extracellular fluid. Fluid has more calcium. That is going to be extracellular fluid. More phosphate. Intracellular fluid. And loveliness that is, chloride tends to chase sodium. So if we have more sodium outside than in, we're going to also tend to have more chloride trying to get out. And this is all going to play a balance. So typically it's about a 60-40 split. Now there's a little bit of variation of about 5% between males and females, but it's about a 60-40 split. 40% of our body is going to be more solids, so those solutes, 60% fluid. That fluid is going to be divided into two major compartments. Intracellular, so what is located inside the cells, that's going to make up about 66% of those fluids, and extracellular, or what's found outside of the cell. That's going to make up the remaining third. Extracellular fluid, though, can be further subdivided into two major categories. About 80% of that extracellular fluid is going to be found around the cells, while the remaining 20% is going to be found inside your blood vessels. There are only two places where this exchange can occur between these fluid compartments. Cell membrane, that will be the exchange between the intracellular and extracellular fluid, specifically the interstitial fluid, and at the capillary, and that will be the exchange site between the plasma and the interstitial fluid. That's the only two places we can have these cross. All right. In case you were not aware, there's something that is known as physiological saline. This guy right here. For those of you in our nursing track or phlebotomy, you need to become very comfortable with this. Physiological saline is 9 grams of sodium per liter of water. It equals out to actually about 5% saline solution. Why is this important? Why did I mention phlebotomy? This is what we will typically give to an individual to help rehydrate them and or to replace lost fluids if we have removed plasma. Let's say you have an individual, they donate plasma. When you donate plasma, you draw off the blood It goes into a machine, it spins, it's a centrifuge. That centrifugation separates the plasma from the red blood cells and the white blood cells, let's be honest. That machine sends the red blood cells and white blood cells back to you, but it can't just send the red blood cells back. That's going to create an imbalance. We are no longer going to be isotonic, but they can't send pure water because that is also going to create an imbalance. This is where physiological saline comes into play. If we send back your red blood cells in a 5% saline solution, that's enough saline solution to equal the amount of plasma, or roughly, that we drew off, you maintain an isotonic state until your body creates its own plasma again. And it doesn't harm you. That extra sodium will just get taken care of by your kidneys. Now, if you have a kidney problem, that's a different conversation. Now, the other thing you need to be aware of, especially if you are going in the nursing track, is what is referred to as a Ringer solution. Ringer solution is an electrolyte solution. It's a combination of sodium, potassium, and calcium salts, as well as sodium bicarbonate. And here we have the exact proportions, but it equals about 5% electrolytes per liter of water. And this is what we will give you if you are dehydrated. Specifically, dehydration is where we supply this. And that finishes up Unit 3.